Thank you for choosing Sensieva, the gentle, less invasive, and less painful method for collecting routine blood samples. This video will introduce the Sensieva family of blood collection techniques and demonstrate how to successfully collect samples using the materials provided. Sensieva collections involve either a capillary monovette or a venous blood draw using a pediatric gauge needle. Your office may have been provided two types of Sensieva collection supplies. The first is for our droplet sampling and includes a capillary monovette collection device, lancets, and a shipping tube. The second set of supplies are for Sensieva venous sampling, which includes a pediatric gauge butterfly needle and vacutainer tubes. Also needed, but not provided, are gloves, sterile gauze pads, alcohol wipes, a bandage, and a tourniquet, which is used for venous sampling only. Your office may choose the appropriate collection technique for each patient. Before beginning the collection procedure, fill out the test requisition form, paying special attention to the highlighted sections. It is also helpful to organize collection supplies needed for the test. Sensieva droplet sampling utilizes a small finger prick from a lancet to produce a minimum volume of 100 microliters of blood. It is a great alternative for patients with difficult-to-draw veins or that have a fear of needles. It is also good for children or the elderly where collecting large amounts of blood is challenging. The first step is to prepare the finger for collection by warming the hand to increase circulation. This can be done using a small heating pad, running the patient's hands under warm water, or by simply having the patient sit on their hands for a few minutes until the hands are warm to the touch. For sampling, it's best to select the ring finger on the patient's non-dominant hand. Use the alcohol wipe to disinfect the inside pad of the finger using a gentle circular motion. It is very important to allow the finger to dry completely before moving on to the next step to prevent blood clotting that would inhibit collection. Once the finger is dry, press the lancet firmly on the inside pad just above the fingernail. For best results, ensure that the lancet is positioned so the blade cuts across the grain of the fingerprint. Wipe away the first drop of blood using the sterile gauze pad. Tilt the hand down and begin milking the finger to produce large drops of blood. Do not over-squeeze the fingertip as you are milking because it can cut off blood flow and lead to an unsuccessful collection. As the drops form, position the capillary tube of the monovette to collect each drop without making contact with the finger. Repeat the process until a minimum of 100 microliters of blood has been collected. It may be necessary to gently tap the vial during collection to bring the collected blood from the capillary tube into the vial. The amount of blood and rate of droplet formation varies from patient to patient. If the full amount was not collected using the first finger, you can repeat the procedure on additional fingers. Once the sample has been collected, use a second sterile gauze pad to apply pressure to the site until you are able to put a bandage on their finger. Remove the cap with the capillary tube by gently twisting counterclockwise and place it in an appropriate blood disposal container. Remove the shipping cap from the bottom of the monovette and press firmly to close. Invert the monovette 3 to 4 times using your finger to gently encourage proper mixing in the microtube. Place the monovette in the shipping tube and press firmly until the monovette is seated against the top of the tube. Remove the safety seal label from the test requisition form and place over the top of the shipping container so that the barcode label can be easily scanned by the Insource team upon arrival at the laboratory. Sensieva venous sampling uses pediatric butterfly needles to reduce the pain and discomfort associated with traditional blood draws. A licensed phlebotomist will collect 2 milliliters of blood into the appropriate number and type of vacutainer tubes. Once the sample has been collected, it is ready for shipment. Fold the completed test requisition form and patient demographics and place them in the back pouch of the specimen bag. Place the specimen tube in the front pouch containing the absorbent pad and seal the sample for shipment. The completed sample package, along with any other samples that are ready for shipment, can be placed into a FedEx or UPS clinical pack for shipment. If for some reason the samples cannot be shipped out on the same day as collection, check with your Insource representative about the stability times and storage conditions for the test you are ordering. Once your sample has been received by the lab, the turnaround time depends on what test is being ordered. Results can be delivered to your office by mail, fax, or online portal. If you have any questions about the results, our clinical staff is available for consultations from 7 to 5 p.m., Monday through Friday, Pacific Standard Time. If you have any further questions about Sensieva or any of the other diagnostic tests that Insource provides, please contact us at 626-386-5277 or on the web at www.insourcedx.com.